is when you're doing one of the paradoxes when you're doing outreach is that sometimes the people you really want to reach won't come to your events. And I think that's definitely likely to be the case with people who are unvaccinated. But I think there's a way to use social networks to try to reach the unvaccinated. So another thing I'll talk about is what to watch for when you're talking to a friend or a neighbor who is hesitant or resistant to vaccination. So there's some clues in how they describe their hesitation, which can inform you about how close they are to, to kind of moving a little bit on the path to vaccination. And the last thing I'll talk about is how to figure out why the person you're talking to is hesitant or resistant, and how you might want to tailor your response to where they're at in terms of the stages of change, which I'll explain later. Okay. Now, so I'll start with an example, and this occurred in June of this year at a park, and I had just returned from the United States where I got my second shot of COVID vaccine, and I had done my 2-week quarantine, which was really hard to do because when you travel, you have to do a 2-week quarantine. So I go to the park and I'm wearing my mask. I photoshopped a mask on my face over there, and I hear someone call my name, and he comes running over and he says, "Oh, Richard, I haven't seen you in so long. How are you doing?" And right away, I was a little nervous because I was just coming out of quarantine and I had my mask on and he didn't have a mask. So we had a conversation, and I'll show you. I said, "Oh, I have to wear my mask. I just got my second shot and just came out of quarantine. Uh, are you comfortable interacting since you don't have a mask?" And he says, "I never wear a mask. The whole year we've been here, I haven't worn a mask." And I said, "Oh, that's surprising. Did you get your vaccines?" He said, "No, I'm not getting my vaccines." And I was kind of taken aback because I knew him from church. I knew him from the neighborhood. He's a scientist. He's a sensible guy. I always liked talking to him. And he's telling me that he doesn't wear a mask. He's not getting a vaccination. And I was a little shocked, but I didn't want to say anything right away. So instead I said, "Oh, I know some people don't want to get vaccinated. Some people don't want to wear a mask, but you don't go to those anti-mask marches, do you?" And he said, as a matter of fact, he was bicycling downtown 2 weeks before. He loves bicycling. And he saw the march. And some of the marchers talked to him, and he joined the march. And he said, it was the most amazing crowd. No one wore masks. They were so friendly. They hugged you. They were like your friends. And so he's gone to like 2 or 3 more marches. So he's one of these people who's parading around Montreal protesting against masks. So I was kind of trying to digest this, and I used to talk to him a lot about his mom, who's 90 years old, and he has like 5 siblings. So I said, "How about your mom and your siblings? Are they vaccinated? Do they wear masks?" And he says, "Oh no, my mom had COVID, but she still doesn't wear a mask, and she's still not vaccinated, and none of us wear a mask." And then I say, because I know he has 2 kids who are in university now, and I says, "How about your son and daughter?" And he says, "Oh, they're vaccinated. They always wear their masks. They even wear them outdoors. They even wear them when they come over." And then I thought I had an opportunity. I said, why do you think they wear it and you and the rest of the family doesn't? What could be the difference? And he says, they don't understand science. If they understood science, they would know that there's no evidence that COVID-19 is any worse than the flu. And there's no evidence whatsoever. If you understand experimental randomized control studies, you would understand there's no evidence that vaccines work. At this point, I was kind of at a loss for what to say. And to be honest, he was kind of scaring me. And so I said, oh boy, I just remembered I have a lasagna in the oven and I forgot all about it. I got to go run off. It was great meeting you. Hope to see you again. And then I dashed off. And I'll be honest, I was glad to get away because I was so surprised and I was uncomfortable because here is someone who I liked, I respected, who has a science background, and he was saying things that I didn't think were correct. Now, I think all of us will have this experience. Uh, we probably won't have it in our close family because our close family will follow what we do. So my guess is your siblings and your parents and your kids. Sometimes they don't, but most of the time they'll follow your health behaviors. But with neighbors, with friends, with acquaintances, this can happen. So I think it's good to ask ourselves, what are the reasons why people aren't getting vaccinated? Or at least what do people tell us? Because I think you could rank order the reasons in terms of how credible they are versus how crazy they are. So I'll show you. Here's a reason that a lot of young adults give. So I've been talking with students at McGill and I asked them about their friends. And what they say is that most of their friends just say, I haven't gotten around to it yet. So, undergraduates are slackers. They're kind of careless. It's a time of life where you're not as focused on goals and health. And I think this is a plausible reason. And I think we should be hopeful about young adults who say this, because that probably means they might be persuadable. You might find a way to talk to them. In fact, you might find a way to talk to them so they'll come to your pop-up clinic in a couple days. So these people I don't worry too much about, but I would talk to them and ask, well, what do you think might motivate you to actually taking action? Or is there any way I could help you? Could I drive you there? Could I do something? Okay. Now here's another very reasonable and plausible explanation, which is, I'm not going to get the vaccine because when I had the flu vaccine 3 years ago, I had a terrible reaction. I was sick like a dog for 2 weeks, and I'm not going to go near this new vaccine. Now, believe it or not, I don't think that's so bad either. There, what we can do is we can empathize saying, oh, that must have been so terrible. I could see why you're haunted by that. But then we could try to give some information or ask some more. And we could say something like, the, the COVID vaccines really aren't that similar to the flu vaccines. And I'm sure a doctor or nurse can explain how much of a risk there would be to having the same kind of reaction. And it's a problem that can be worked out. So that one I think we could manage. Now, here's, I think, the most common explanation that people in the United States give. And something interesting happened about this one. So most people will say the vaccine is too new. They slapped it together too quickly in less than a year. They're using us as guinea pigs. And the FDA hasn't even approved this vaccine. It's only emergency use. Well, the FDA did approve it 3 weeks ago. And they went back to these people who are saying this, and they still say they're not going to get vaccinated. So it was a ruse. I think it is this suspicion that the pharmaceutical companies are trying to make a lot of money. It was put together quickly and shoddily, and you can't trust it. Now, never mind the fact that 2 billion people have taken this vaccine. No one's ever taken, there's never been a situation where so many people were tested on the vaccine. But I think this is a tough one. And when people say this, if you are able to convince them about one part of this, they'll find another thing. So I'll come back to this one. This one's pretty tough. Now, here's one that I actually worried about when the Delta variant came along. So some people will say, why should I take the vaccine? A lot of people who are vaccinated are still catching COVID. So that proves that it doesn't do anything. Well, not really. The people, the COVID vaccines were never 100% effective. It was a miracle that we have vaccines that are 90% effective. We were only hoping for 50%. But if it's 90% effective, there's going to be breakthrough cases in 10%. And with the Delta variant, there's a higher percentage. And it does seem like more people are catching it, even though they were vaccinated. But if you look at hospitalizations and if you look at deaths, it's almost 95%, the doctors can correct me, it's from the unvaccinated who are getting seriously ill, and they're still more likely. So I think we have some facts, but the facts won't work. I'm going to tell you that you need more than facts. You need to listen, you need to be empathic, and you need to take a roundabout persuasion method. Okay, here's my favorite. Oh no, this isn't my favorite. We don't know the long-term consequences. And I think that's a really fair one. And in my lab, we couldn't really think very quickly of how to respond to that because we don't know what will happen a year after you have a vaccine or 5 years. But I think the answer is we also don't know exactly what will happen if you get COVID. But we already know that there are long-term effects from COVID that seem to be much worse, including death, of course. But there's other long-term symptoms from COVID that are far worse than anything we could imagine from the vaccines. Now, here's my favorite. So some people, and you would be surprised how many Americans will tell you this. I'm an American. So some people will tell you there's actually a 5G chip in the vaccine, and the government will be able to track every move you make. So think about this for a second. Here's a life-size picture of a 5G chip. Here's a picture of a needle with which you would inject the vaccine. How is that chip going to fit in that needle and go into your bloodstream? And then it's supposed to like dissolve in your blood and reconstitute and then send messages to the FBI or the CIA. It's like crazy. This is a conspiracy theory that, there's no point talking to people who tell you this. I actually would stay away from those people. No, probably we do have to find a way to talk to them and reach out. But here's what I'll say then is that there are some general rules. And these rules come from doctors and psychologists and psychiatrists trying to help people change their behavior. So trying to help people who want to quit smoking or stop drinking or stop taking drugs. The approach that seems to be most successful is something called motivational interviewing, where they first have a theory that there's actually 6 stages of change. And no one can go from 1 to 6. You have to go progressively. So the very first stage, it's indicated at the top of that spiral, it's pre-contemplation. Those are the people who they don't think they have a problem. They think we have the problem because we're getting vaccinated and we're a bunch of sheep. So those people, you can't hope to get them to go to your clinic. All you could hope is that they maybe begin to think a little bit more about their position. They begin to maybe look at some contrary evidence. Now, the next stage is contemplation. That's where people realize that they probably should get the vaccine, but they're finding reasons not to. The next stage after that is preparation, where they're gearing up. I think a lot of the young adults could be in this category. They're gearing up. They haven't gotten around to it. They might have some slight fear about it, but you can probably talk to them and help them start preparing. And if they're prepared, then you could get your car and you could make a date and drive them to the clinic on Saturday. Now, once people are vaccinated, or once people quit smoking, or once people quit drinking, you have to keep them on the wagon, or you keep them off the wagon. Because one of the problems is people can relapse. And I'm surprised how many people got one vaccine, one shot, but they haven't gotten their second, and they don't seem to be in a hurry. And so they're kind of failing at this fifth stage, which is staying on guard, staying with the behavior and watching it all the way through. And we're all going to have a challenge because in September, October, November, if you're my age, you're going to have a third shot. I'm happy to get a third shot. I call myself a multi-vaxxer. I will get 5 or 6 shots if I could get them. I really believe in the vaccines, but uh, some people stop after one. Some people don't even reach that. And so there's these 6 stages, and the goal of our interaction should be trying to increase the odds that people will just move one step further. So in your conversation, you ask some open-ended questions, and this helps you figure out where people are. Are they like conspiracy crazy, in which you can't move them probably? Or do they have some explanations that might be plausible, but maybe could be changed? So you begin with an open-ended question. So my friend, I'd say, so Joe, I'm a little surprised that, you're not vaccinated and that you're not wearing a mask. How did you arrive at that position? And then I'd listen. And he would say, well, this or that. It's and I'd say, oh, I could see that you haven't believed this from the start. He was actually on a cruise ship in Australia. And the cruise ship had to land in Australia because it had COVID cases. And then he flies back and he still doesn't believe in. So I would listen. And then the other thing you do, and you know about this, you reflect where you say, I can see you feel really strongly about this. And you probably aren't open to any other suggestions. But then you could ask an open-ended question that flips it, that kind of challenges, where you say, Joe, I wonder, is there any evidence that could come out that could change your mind a little bit? Like if the FDA approval came, if 5-year-olds were getting it, if they did a trial with 2 billion people and showed that it's working fine, would that convince you? And the final thing, and my sister's a nurse practitioner, and she works with moms who don't want to give their 12 to 18-year-olds permission to get a vaccine. And she tries to convince the moms who really care about their kids' health, but who have issues with this vaccine. She tries to engage in a conversation and gradually bring them around to where they'll consider letting their kids have a vaccine. And she says what she finds is most important is you can't be heavy-handed. You can't blame them. You can't try to overpower them. You should be gentle. You should try to nudge them, but you should actually say, this is totally up to you. I don't want to tell you to go get vaccinated. Well, maybe she wouldn't say that. I can't force you to get vaccinated. This is under your control. But as a health professional, I have to tell you the reasons why I believe it's important. And then you could tell me why you disagree. So now this seems like a lot, but doctors who talk to their patients about smoking takes 3 minutes. It's possible to do this in 3 minutes if you're a doctor. I think as a friend or an acquaintance, we'd want to take 5 or 10 minutes. So in conclusion, I'm suggesting that rather than running away like I did from my neighbor, Joe, we consider a different way of responding. It's like once we see the person is against vaccines, we should anticipate all of the other rigmarole they come up with. And we should be patient. And we should look for an opportunity to listen, to reflect, and maybe to shift and move them a little bit. So now I'll conclude. I hope I haven't gone too long. I think we're likely to have people in our life who are unvaccinated. It's probably your neighbors or people at church. I also know Joe from church, or it's people uh, who are acquaintances. I would say we should not only listen and talk to them, we should look for them. If you know there's a neighbor on your block who's not vaccinated, and if you've come to this meeting and if you care about vaccination, maybe strike up a conversation and lead toward asking about this. Now, try not to be angry, scolding, or rejecting. You can be angry, scolding, and rejecting in your own mind when you're away from these people. But when you're there with them, you have to manage your emotions, and you really want to be gentle and caring. You try to listen, you try to gauge which stage they're at. You see if you can ask a question or make a comment that can get them thinking about the vaccines in a different way. And I think there's a chance this could work with some people. There's other people, there's no chance in hell. The the people who believe that Bill Gates is injecting 5G discs in your vaccine. I don't think we can help them too much, but there's many people we can work. And most public health successes, you never get 100% right away. You gradually build. And then when another person gets vaccinated, they might convince another person. So I think it is a bit of a slog. I have a feeling that the mandate to have a vaccine passport, it will have an impact. I think young adults, when they can't do some of their fun things, they will want to. Uh,
Could I say something?
sure, yeah.
Okay, I'm not vaccinated,
Oh,
and I'm one of the ones that aren't vaccinated, but I don't trust it either because another thing, it's been done too fast, and it seems like nobody really knows if it's effective or not, or like a lot of times you call and nobody knows like the long-term effects either.
I think that's the most, boy, thank you so much for speaking up. That takes a lot of courage. And I'm sorry, I should have anticipated that some of you may not be vaccinated. And I can tell you that in my lab, we were trying to think of all the reasons. And the long-term effects one is the one that we have the hardest time. So another thing that people will say is a young woman will say, I don't want to take the vaccine because it's going to make me infertile. And the science says that's not the case. But then a student in my lab said, but there's been no long-term studies. Maybe it doesn't make you infertile right away, but maybe it will make you infertile in 10 years. But I think what the medical scientists do is they look at the risk versus the benefit. And the risk of not getting vaccinated is catching the COVID disease. Now, I've been tracking this since last February or March, and that's because the first outbreak was in New York City, and the very worst outbreak was in Elmhurst Hospital, where I was born and where my mom would take me if I needed stitches. And that hospital now is in kind of a lower economic area. And people were dying so fast in New York that they had to have 4 or 5 giant refrigerator trucks to uh, move people over there because COVID-19 is an incredibly deadly thing. And now, because of the Delta variant, it's highly transmissible. So what the medical scientists do is they look at, okay, what's the risk of catching COVID? What will be the consequences of that? And then what are the risks of taking the vaccine? And what are the consequences? Also, these are not really new vaccines. Everyone says they did it in a year. They actually built it on platforms that were in development for about 12 years. Also, there's never been as many labs and doctors working at the same question. So the amount of scientific brain power and scientific evidence, there's never been anything like this. It's the equivalent of sending a man to the moon. Now, I know I may be going overboard, and this probably isn't recommended when you talk to people who are hesitating. But uh, what I would, so let's say I was talking with Joe, who I know and who's my friend and who I've known a long time. If I do meet him again, uh, I would say, Joe, I don't understand. We've known each other a long time and we agree on most things. We agree about the Canadians. We agreed they needed a new coach. They got the new coach. Why are we having so much trouble agreeing about this, the question of whether the vaccine is safe or not? It's been given to so many people, and there's so many health officials who stand by the fact that it's safe. And then on the other hand, you have the doctors and nurses in the hospitals saying, if you could see what this disease does, and if you could see how it affects families, I mean, we would all get the vaccine. So, boy, I'm glad you asked this question because I realize I need to train a little bit more on how to actually talk to someone uh, who uh, who hasn't been vaccinated and who has concerns. But maybe one of the doctors could help me with this as well, Farah or someone.
Yeah.
Actually, I was raising my hand just to ask the question because thank you so much, Mrs. Laverne, to putting yourself out there and being so authentic. And I was actually going to turn the question to Dr. Kostner as a motivational lab researcher. Obviously, people have heard the science. So that's not the point, right? It's not about the science. And they also have the arguments that come forward are the same.
Okay.
It's been done too quickly.
Yeah.
So I wonder what is the emotion that is
Yeah.
behind that could be moved forward?
Okay.
Because the parallel you make
Yeah,
with
yeah.
the cigarette is exactly that. People know that they'll get lung cancer, they'll get
Yes.
whatever disease, but there's always, how can we motivate them? And so,
Yeah.
yeah.
Now, with motivational,
Before Farah, you came with the BCRC,
Yeah.
I'm sorry.
or I've seen you before.
Yes,
Yeah,
I've
yeah.
seen you. Yeah, I saw
Yeah,
you
yeah.
on June 17th. Yes.
Yeah, yeah.
Thank you.
That's very well put, and I think you're correct. The assumption with motivational interviewing is that with smoking, with vaccines, we feel ambivalent, that many of us have some fear and we have some approach. And it's a matter of resolving the ambivalence. And sometimes you can do that by talking to other people. Now, I think at the heart of it is uncertainty and anxiety. And we are living in the craziest time that we've ever lived in. I can't believe that we're in a fourth wave. And I can't believe how much our lives have changed. And it's very easy to feel like you as an individual person have very little control in your life. We're being overwhelmed by changing economics, changing technology, and changing viruses. The way this variant is going through the Greek alphabet, it's frightening. Now, when we're scared and when we would like to have control, there's a choice about, okay, I could get the vaccine, but I have to do that. I have to make the decision. And if I get the vaccine and if I have a bad reaction, if I become infertile, which I don't think happens, if I'm sick for a month, if I have a blood embolism or something, that's because of that decision I made. On the other hand, if I do nothing, yeah, a lot of bad stuff might happen, but at least I didn't bring it upon myself. So I think, unfortunately, there's kind of a funny thing that happens where we think, oh, there's more risk of doing something than not doing something. And there's more personal burden. And that's why I think we need social support. That's why I think we need to talk to other people. I don't have an answer, Dr. Desiri, to how to solve that. Now, the motivational interviewing has been used with smokers. It obviously, you can look around and you can see that it hasn't solved the problem, but it does reach some people. And so I know that with smokers, if they have a GP or a personal doctor every year ask the smoker,
Exactly.
are you still smoking? Have you thought about quitting? What would it take for you to think about quitting? And if the person says, yes, I'm thinking about it, then they get help. So in a typical year, 2% of smokers might quit. But if doctors do this intervention that only takes 3 to 5 minutes once a year, you get 10% quitting. And then you do that year after year and you have an effect. I think realistically, I think the person who asked the question, her feeling and her beliefs are probably representative of a lot of people who are hesitant. And I'm, I'm not sure if what I'm saying is convincing, but I do think if a friend who she trusted or a doctor she really trusted, I'm sorry about talking about you in the third person, uh, had that conversation, it might reach better. And I think that's our best hope, is in our communities, in our neighborhoods, in our families, on our streets. If we could find some rapprochement between the vaccinated and the unvaccinated. And I think a big part of that has to be what my sister says, which is, I don't want to come across as saying you have to be vaccinated. That's really your decision and it's your personal freedom. I can just tell you my beliefs. So I don't know. We have 2 more of these meetings before our next meeting. I'll try to study up on this and try to have a better answer for that.
I
If I
find
could
like a
just,
lot of people will tell me that I need to be that I should get vaccinated. Or one person told me, well, if I don't get vaccinated, people won't want to be around me. I said, well, that's their problem.
Yeah.
And then another thing, I find like you're forced into, people are trying to force you into being vaccinated. Like for instance, Legault, he had a lotto. Like people are trying to bribe you into getting the vaccination. And I don't think that you should be bribed into something like that. And also, I don't believe that, because you're not vaccinated, it's almost like you have the plague. You can't go here, you can't go there. And to me, that's wrong.
Yeah. I can say one other thing. When I talked with my friend Joe, he told, because he's on Facebook. I don't use Facebook so much, but he told me he had to get off of Facebook because he said there was so much vitriol against him when he came out as someone who goes to those marches.
Mhm.
So I think those of us who are vaccinated, we often think we're kind of on the side, uh, you know, we're on one side, but we don't realize that the other side is actually facing a lot of anger and harsh comments from other people who are vaccinated. And it's so polarized. So I think what you're saying sounds accurate. And I think it's hard to do this kind of gentle, open-ended conversation. And it's probably hard to do it in a way where you're not kind of hoping that they'll change their mind. And I think, like my sister says, there has to be something authentic about how you come across. So it really does seem like, yeah, at some deep level, it's the other person's choice and it's under their control.
It is, but people always act like, you should do what they do. You should be like the follower, but I'm not a follower. And I feel if I want to do it, I'll do it. I mean, eventually I might, only because I have family in the States
Yeah,
and I would like to travel to visit them. And without being vaccinated, I mean, I don't have any medical condition that would stop me from being vaccinated. But I just feel that I'm still being forced into it because of like, I would like to travel to visit my family in the States.
yeah,
And otherwise, if I don't do it, I can't visit them.
yeah,
Like everybody's forcing you into everything. And I just feel it's so totally wrong. I understand. I'm not saying I can't get the virus. I mean, not the virus, but the variant, whatever. I could get it just like the next person, but it's my choice if I want to do it or don't do it. And like when you call up the number, like once I called up and I asked the woman, well, how safe is the vaccine? Oh, I don't know. You have to speak to your doctor. They should have a number when
Yeah.
you call and say, look, call this doctor. We have a doctor, you know, that you could call and ask questions besides your family doctor, which they don't.
I
You know,
agree with that totally. And I think that's something that our group should try to do too. So the people who've come to this open house and who have questions, if we could provide information or link you up. Well, there will be doctors talking shortly. So actually
Yeah.
maybe I should stop talking. And Omar, I'm really sorry about this. This ran on too long. And I'll stop there and let's go on to the doctors who know something about this.
Great. Thank you so much, Dr. Kostner. So
Yeah.
that was very insightful and thought-provoking, and we really do appreciate all the work that you did behind this presentation and for sharing with us based on your research and expertise. So we are short on time, and we'll definitely like to go into the third and final section of our event this evening. So without further ado, I would like to introduce our panelists for this evening's discussion, where we'll be focusing on the COVID-19 vaccination and the continued opening of society, what has been uncovered so far, and how is this pandemic evolving. And so this evening we have a very multidisciplinary roundtable speakers. So first of all, I'd like to introduce them. So we have Diane Sarré. So Diane Sarré is a physician who graduated in Burkina Faso. She currently works as a planning, programming, and research officer at the Regional Public Health Department of Quebec. She holds a master's degree in public health from the University of Montreal. She has a sound experience in planning, implementing, and evaluating community-based interventions based on infectious diseases, and is also specialized in knowledge transfer and change management. So she's actually currently involved in the response against COVID-19 as a specialist in the infection prevention and control and biosecurity measures since the first wave. And she's currently involved in raising awareness about the vaccination in various settings, so healthcare centers, schools, universities, homeless people, and parks. And we're really delighted to have her join us this evening for this panel discussion. Next, we have Mr. Michael Farkas, who is a strong community leader, very active in our community. He is the president of Youth in Motion, which is an inner city youth center in Little Burgundy. And also he is the lead representative and president of Montreal's Black History Month celebration. He is an urban mediator at the Burgundy Urban Mediation Project. And he is very passionate about Black history, about the Black community, and being so involved in the community, he is exposed to the various concerns that the community has about the COVID-19 vaccination. He spends most of his time working with the community to come up with ideas and starts projects in order to advance the work that is being done. So we're very delighted to have him join us this evening as part of this panel discussion. Next, we have Dr. Makeda Simrat, who is an associate professor of medicine, infectious disease, and microbiology at McGill University. She is also the director of the McGill training program in infectious disease and biology, and program lead for the antimicrobial stewardship program of the McGill University Health Center. So her research is focused on stewardship intervention to contain antimicrobial resistance in high and in low resource settings, as well as clinical trials on therapies for COVID-19. She is the Canadian PI for the Pilgrim Consortium Impact of Prescription Quality, Infection Control, and Antimicrobial Stewardship on Gut Microbiota Domination for Healthcare Associated Pathogens. So she's also the lead cohort study assisting assessing the impact of laboratory strengthening and stewardship on healthcare associated infections in Ethiopia. So we're very delighted to have you join us tonight as well, Dr. Samret. And last but not least, we have Dr. Patrick Dossé. So Dr. Patrick Dossé is a medical microbiologist and has been an infectious disease physician in Rimouski since 1992. He is a consultant for all hospitals in the lower St. Lawrence River region, Gaspé Peninsula, and Côte-Nord. His main interests are in infection control and prevention, antimicrobial resistance, and computer science. He is a past member of the Quebec Provincial Nosocomial Infection Committee from 1992 to 2012, for which he has served as president in 2001. He is also the president and founder of Nosotec since 2007. So currently with 20 employees, he dedicated to software solutions for infection control, antimicrobial resistance, and epidemiology. In 2005, he received the Lindsay Nicole Award, and he is recognized for the best published paper. In 2018, he received Excellence in Healthcare Innovation Award from the Quebec Federation of Medical Specialists. So as you can see, we do have a very high caliber speakers here tonight for this segment. And so without further ado, I'd like to start off, and I'll just share my screen here. So the first question I have, and I'll start with Dr. Dossé this evening. So the first question I have for you is, how does the COVID-19 vaccine work?
Actually, the vaccine, it's an mRNA vaccine, which is the part that constructs the protein, the spike protein of the virus. So in a short way, it works like it's a very simple. It's a very intelligent way to develop a vaccine, and it's a very safe way. And also they had a lot of experience with the SARS-CoV-1, which occurred around 2001 and also there are other coronavirus which occurred in the Middle East. So we had a lot of experience with that. This is why the building of the vaccines, of that kind of vaccine, was very fast. It's one of the main reasons. And also, so you inject the RNA in your arm, and then it produces the spike protein, which is one of the proteins of the COVID, and then you develop an immune response to that, and the antibodies go to attack the real COVID virus in a short way.
And in line with that, like, how long would you say that the antibodies, they stay for protection?
Actually, excuse me, the data show that the antibody response, it lasts many months, many months, maybe 6 to 12 months, but we don't have that much experience, since it's quite a new vaccine. But we feel that if you get 2 shots, that your antibody response will be able to combat most of the virus, most of the variants that can occur. And also you have an excellent response. In a matter of fact, the immune response for to protect you against new infection is about around 70 to 90%. So, and maybe more close to 90% if you that you won't get an infection. And the best part is that the efficacy to prevent hospitalization is more. It's about maybe 95%, and it's almost 100% to prevent death. It's not 100%, of course, but it's close to 100%.
Okay. Thanks for sharing that, Dr. Dulcie. And now, the second question that you know we have around that, and I'll go ahead and ask Michael this question. So, in line with what we've been hearing, from the medical professionals, and this is information based on science, and all the research that's been done so far. As someone who is working in the community and interacting with youths and the general population at large, what are some of the major concerns that people are raising around the vaccine? Especially, we have solid research that's been done so far, and as we discussed in the previous segment, there's still resistance, right? And I with several reasons, everyone has their reservations, but can you highlight some of what you've heard so far in the community from youths, and given all this information, the scientific information that we've had so far?
Yes, thanks, Omar. Good evening. First, most Black folks, they talk to God first to ask him even if they should or shouldn't take the vaccine. So the religious component is crucial. Same thing with a lot of people from the Muslim communities. Same thing. So they got we have a problem just for that, to take the vaccine. We talk to God. On a perdu le nord. Je vais m'exprimer dans les 2 langues parce qu'il y a beaucoup de francophones. On a perdu le nord d'après moi. Parce que here we are, and I'd like to take 1 second to at least send my condolences to the Jamaican Association for the great loss of Noel Alexander, the Honorable Noel Alexander, because that's what we should be talking. If we don't have the COVID, we'd be talking about how can we go forward without Noel, because that's a normal way of life. This COVID has taken everything aside. So I just sending to everyone that's been touched, everyone that loved Noel. I want to take a time to say personally to the Jamaican Association and to Sharon, let's get back things in order. This COVID has taken, it's everything. So we talked to God, and a lot of things that Mr. Costner said, Dr. Costner, I totally agree. These are the same angst that are plaguing the Black folks. Medical poor experience in the past on us. He named a lot of them. The sperm count business, their infertility. I hear a lot of that. Money is a big part of it, meaning how much Canada assigned to get all these vaccines that they have to pass. So that's what I hear. And Mr. Costner also said, Dr. Costner, sorry, also said a second shot, and he's willing to take more. I had to shut down my thing for a second because most of us, it's enough. Tu vas arrêter de charcuter mon bras, là. We want to get on with our lives. I'm sorry to get so passionate, but it is a passionate, like Dr. Costner said, It really, really has taken a political twist, meaning anything that's medical, a vaccine should be of private matter. Now it's of national order, to the point where, like Laverne was saying, you can't enter this place, you can't enter that place. I've taken the vaccine because I work a lot with the entire population, and I want to, move on. I still have some of my kids that haven't, and it's, I have to allow, just like Dr. Custer say, you can't really twist their arm to go get it. But I want to get it over with. I want to, it's like, finish just to say another thing. Bob Dylan says, when you got nothing to lose. And like a Rolling Stone, quand t'as rien, là, t'as rien à perdre. C'est ça que Legault, puis beaucoup de docteurs, puis beaucoup de monde, ils n'ont pas compris que quand tu es pauvre, quand tu vis la pauvreté, là, c'est pas en mettant, it's not by blocking us from going to this cinema and everything. That's just capitalist, whatever it is. The restaurant and everything. Anyway, our youth are in DoorDash, and they know how to pick up their food. And if 2 of their friends are not vaccinated, I bet they won't go to the restaurant. So in the Black community per se, and in certain cultural communities, it has not impressed us that they have put in place the passeport vaccinal, meaning we've already been dropped. We're poor. So we already out of the game. This is what some of you and the political need to know, that many of our youth don't feel a way. Many of the parents don't feel a way. They hang on to God according to their denomination. And the capitalist game of going to the movie and the restaurant, they can make without for the time being. And I'll stop there. Thank you.
Thank you, Michael, for sharing your observations of what you've seen throughout your community work so far.
Can I just ask one question, Omar?
Sure.
Okay. Even though you have the vaccine, why do people still get COVID, even though they've taken the vaccine? That's one thing we'd like to know.
I'll have Dr. Dulce. Do you want to take that question?
Yeah, the vaccine is not 100% effective. It's around 95, 90%. If you got 2 shots, if you got 1 shot, it's about maybe 70%. If you get the 2 shots, about maybe 90%. But it's never 100%. But you'll get a lighter illness. So.
But why do you need 2 vaccines?
So.
I was asking, why do you need 2 vaccines then? Why isn't 1 good enough?
Because the efficacy comes from 70% to more around 95%. So there's an improvement. And most of your kids already had about 2 shots for most vaccines, and maybe more than 2 shots.
But is people going to get a vaccine the vaccination every year? Do they know that yet?
We don't know yet.
Okay. Dr. Semrad, I think you had your hand raised.
Yes, can you hear me?
Yeah.
Yes, yeah. I just wanted to reinforce the fact that, what the vaccine is not a big product. The vaccine is a tiny, tiny little molecule that what it does is it stimulates our own immune system to defend itself against the virus. So in order to answer the question about why doesn't it work all the time, why do some people still get it? Well, there are a lot of people out there whose immune system doesn't work very well, either because of extremely old age, or because they have a cancer, or they're going through chemotherapy treatment, or other types of treatments which really abrogate or sort of dampen their immune system. In those patients, or in those people, you can vaccinate them, but you have no way of knowing exactly how their immune system is going to work. So the vaccine is not a medicine. It's not a chemical that you're introducing into somebody's body. You're just exposing it to a bit of the virus to simulate or to make it look like you've been exposed to the virus, but in a tiny amounts, so that you can mount the response that will allow you to defend yourself against bad disease. So I'm listening to all of that, and I'm really sympathetic. I'm not somebody who is in public health. I'm not a vaccine advocate, in public health. I'm a doctor, and I treat patients once they have COVID or another infectious disease. But what I really see here is that we actually have a huge privilege, right? We live here. We have a government that's trying to get us to be vaccinated. And I'm not for the government in many other areas necessarily. And it's paying for all of this. Meanwhile, in the rest of the world, and I think the vast parts of the world, all of Africa, big parts of Asia and South America, they're waiting for their turn. And I would say for those people who are saying, I absolutely will not get vaccinated, what I would ask is, are you willing to opt out, to sign a release and say, I want my dose to be donated? And why don't we start donating the doses that we are not using? If people here are saying, despite the fact that I have the possibility of getting vaccinated, I choose not to, I usually tell them, okay, fine, don't. But would you be willing for your dose to be donated to the millions and millions of Africans that are patiently waiting? They've been refused travel. They don't have the money to travel. A lot of them are dying without access to proper healthcare, without access to ICUs. And it also means that we're going to be in a state of pandemic for much longer. So I just wanted to make that little point. I don't want to sound unsympathetic, but it does feel like, this is a privilege.
Thanks for sharing, Dr. Semrit. Before we move on, Horace Laria, you had a question.
No, I don't have a question. I have some statement to make. The people worried about the vaccine being made too fast. There are a lot of reasons for that. Apart from having a base already because of previous viruses and because of especially the Zika virus, there was a platform already made that the mRNA vaccines are put on it. And number two, money was no object at all. All the governments gave the companies large amounts of money. When vaccines are being made, people have to try to get money and people have to get patients. Because the infection was so widespread, it was easy to get so many patients to do the trial in the short time. So this thing was not like a fast rush. It's gone through the same process that the other vaccines have gone through. So people say it was too fast. I don't think they are well informed about that.
Thanks for sharing, Horace. Now, as we move on, as we've been over time, I just had a question for Diane Sarré. So Diane, are you there?
Yes, I'm here.
Awesome. So the question for you is, how can we help ensure that folks receive accurate information about the COVID-19 vaccine, given the information that Dr. Dulce provided to us about the research that's been done and has been scientifically proved, and as well as when we take into consideration all these different concerns that Michael brought up about what's being seen in the community. How can we make sure that we're doing the right research and getting the facts, about the COVID-19 vaccine? What do you have to say?
Okay, thank you. First of all, I want to say that it's very important to encourage folks to look for information on official websites where they can find evidence-based information. And also, I can tell that we can try to collect useful links and disseminate them on our different network. And in our daily working, we try to go in the field to discuss with people, give the information that are accurate, because we can find a lot of people that go to find the information on social networks. And we know that on social network, there are a lot of information that are not true. And I think going in the field to discuss with people help to give accurate information.
Thank you. So yeah, it's important to do our own research and based on factual sources, so credible sources, as we say, and not rely on social networks. So thanks for sharing that, Diane. And the next question that I actually had, and this is for Dr. Semrit. So the question is, will the vaccine change someone's DNA?
No, it can't. No, it's not possible for it to do it. I mean, there's multiple types of vaccines, but the ones that are being given here, as Dr. Dulce said earlier, the mRNA vaccines, they're a tiny, tiny portion. It's not even the whole sequence or a genetic code of the virus. It's a very, very small piece. That's basically the recipe. It's the genetic code is the recipe to make the proteins that then make the virus. So this is a fraction of one of the proteins. It has nothing to do with the human genome. It's not even DNA, it's RNA. So it can't integrate, and it's enveloped in sort of a fatty substance so that it can get absorbed into our muscle when it gets injected. And that just basically tricks our system, our own our cells, to produce a small piece of the viral protein, which is the spike protein that Dr. Dulce mentioned. That's the main protein that the virus uses to go into our cells, to multiply, and etc. So it's a very, very clever solution. And the advantage of this type of vaccine over others is not in the kind of the downstream part. The downstream part, which is the way we respond to vaccines, has been the same since 60 years. So every vaccine, we respond to the vaccine because we're building an immune system, an immune response to the agents that we're seeing in a small part. The clever part about here is the speed with which you can actually scale up, right? As opposed to the old way. So it doesn't go into it. It has no way of getting into our genetic sequence. That's not a real risk. That's kind of some myth that's been perpetrated and repeated, but it's technically not the risk.
Thanks for sharing, Dr. Semrit. And in line with that, like I'll leave you the last question as well with Dr. Dulce. So can you explain to us, we've had several discussions around this and we've heard it over and over again, and we see all the major concerns that, the community has, that, people, the different opinions that people are sharing, but we also see the scientific research that was done. And so can you explain to us, is the vaccine safe, and why are we encouraging our communities to get vaccinated?
Yeah, so far the vaccine is safe. We have the vaccine, again, if we've all had childhood vaccinations. I don't see a big difference between getting a COVID vaccine and getting a measles vaccine when I'm 1 year old, or less than 1 year old. Vaccines are vaccines. This is not a vaccine that has, metal or chemical substrates that that are sometimes added to the older vaccines that we used to add so that to boost the immune response. So I don't have any worries from the product that's, the tiny amount of product that's being injected into my arms or the arms of my kids. I think the side effects or the clotting thing that was described in a very, very tiny proportion of people really has to do with the way they respond to an agent that's injected. There's very good reason to hypothesize that if those people were infected with the virus itself, they might have had exactly the same response, right? There's the human body is beautifully and incredibly complicated, complex machinery. The immune system is very complex, and sometimes there's these pathways that just kind of happen, and there is a clot that might form. But I can tell you that with the virus, the infection itself, we see a huge amount of clots from getting COVID. In fact, the minute somebody comes in with COVID to the hospital, we start them on blood thinners just because 30% of them are going to have a major clot. And the cause of death is often because there is, in addition to a lot of other things, there are clots in their lungs and in many of their major organs, in their kidneys, in their legs, etc. So, the side effects are not because of some chemical product that's being put into our body. Those adverse events have to do with the interaction, with the way we are reacting to it. And so, as I think it was you who said earlier, or somebody said, in all of these things, it's always a risk-benefit calculation. We can't go out the street without calculating that we don't have a big chance of getting hit by a bus. If I walk on the streets of Montreal, my chances of getting hit by a bus are very small. Mm-hmm. Well, right now, with the cases that are raging, both here and elsewhere, the odds of getting COVID are reasonably high for most of us, unless we can stay locked in our house and not see anybody. The odds are high. So the advantage of getting the vaccine, by very, very far outweigh the tiny risk of getting a bad adverse event, whether it's in the short term or the long term. And I mean, this whole notion of infertility, etc., I don't know where it comes from. There's no scientific basis for it that I can see. We can always come up with all sorts of things, and we can say, well, what if 5 years from now, 10 years from now? Well, whenever we think of those things in the field of medicine, we say, first of all, is it even biologically plausible, right? You have to have some sort of hypothesis, some sort of mechanism. You can't just come up with something out of the clear blue sky and say, well, what if I get the vaccine and X happens? Well, what if I eat a bad apple and Y happens, right? Mm-hmm. So I think we have to take a step back and say, where are we now? What's the situation around the world? Where do we live? And what do we have access to? And we also have to have a little bit of trust. If we're willing to go to the doctor or to an emergency room when we're sick, then why are we not going to listen to the same professionals when they're saying, this is good for you? Mm-hmm. We have to be consistent with this. We're living in a community right now. The reason Legault and the government or Justin Trudeau are getting involved is because it's a public health crisis. It's not an individual disease. It's a public health crisis that has immobilized cities and economies and countries. So, they're understandably trying to get the whole population vaccinated so we can finally move on, at least in Canada. But we know that, we're not going to completely move on until the rest of the world moves on. If there's still a lot of cases raging in Europe or in Africa or in Asia, that means we're still going to be facing this, and we're going to be facing variants, and there's going to be people bringing it in, or Canadians going somewhere on vacation and getting sick and having to be evacuated. This is just going to keep going on. So that's the reason why there are some public health measures, and there's attempts by the government to force or to coerce or to incentivize the population to get vaccinated. I don't think we should see it as a breach of our freedom. It's on the contrary, it's a privilege that's being extended so that we can move on and have a free, productive life.
Thanks.
Maybe I could add just a little word about privilege, because we're so lucky we found that vaccine so fast. It's incredible that we found a vaccine months after the beginning of that pandemic. We're so lucky. And if you don't get the vaccine, you'll get the virus then. And instead of getting in contact with a small piece of the virus, you'll get contact with the whole body of the virus, which is many-fold bigger. So, and also you'll get sick. The odds of getting sick, and the bad thing about getting sick is if you get an infectious disease, a contagious infectious disease, then you'll give it to your loved ones, to the people that share your house. So, and this is the bad thing about those infections also. So
yeah.
Anyway, there's a lot of issues. So we could talk.
Yeah, we could. I completely agree. I think, in some cases, I have seen patients who come into the hospital and they were infected by their daughter or their son or a family member, and the family member who may not have been that sick themselves. The original person who introduced it into the household may have been quite okay and had an illness for about a week and survived, but their elderly parent or their sibling or spouse who has an underlying problem, which is no fault of his or her, right? They have something, their immunity is just not strong enough, and that person gets very sick. I can tell you that the guilt after the fact is terrible. It's really terrible, heartbreaking. I mean, we right now, the situation in the hospitals is not as bad as it was in the first wave or in the second wave, but we do have young patients who are in the ICU. We have elderly patients who are in the ICU, many people who've died, and others who've survived, but with very, very badly damaged lungs that are still 6 months later, 4 months later, still in the hospital, trying to recover and going through, rehab and intensive physiotherapy, etc. And, will never have the life that they had before. This is real. You don't know if you're 35 years old or 40 years old and you're perfectly healthy, you could be one, there's a good chance that you'll be okay after a week or 2 weeks, and you might feel the sort of the famous long COVID or the post-COVID fatigue, but that's not life-threatening. It's just annoying, but it's not life-threatening. But you could pass it to somebody who will not do as well, right? You will pass it to somebody who will not do as well. And are you ready to live with those consequences? So, I think it's one thing to say, I don't want it because I'm not 100% sure that this is completely safe and I have my doubts. Well, okay. And then you also have to extend that same argument to say, am I going to make the decision that I'm not protecting people around me, my loved ones, my coworkers, people that I see on the bus, So, this is really, there is a personal freedom thing. I understand that, but we do live in a society, we live in a community, and there is a public health emergency here.
I have a question.
Yeah,
I have a question.
Kevin, that will be your last question.
Yeah,
Sorry.
it relates to the discussion around the virus, and we know communities of color have been disproportionately infected by this virus. And what my question is there seems to be a lot of science out there that says that if you've been infected with COVID, your natural immunity is very strong. So my question is, I don't understand why we're still requiring people who've been infected with the whole virus to still take a vaccine. Could you speak to that for me, please?
Yeah, I think that's a very, very good question. There is no solid scientific evidence to mandate that somebody who's already been infected should have a vaccine. I think the reason behind it is because the vaccine is not going to harm, and if anything, it will serve as a booster. So with any infection or with a vaccine, you know, I think it was what was mentioned earlier was something around the duration of protection. So with the vaccines, because they've been kind of controlled and we'll have long-term data, we have some idea, we're beginning to have some idea of how long that that protection will last. Whereas with natural infection, we're not quite sure. And we also know, the one thing we know about viruses is that they mutate. And we didn't know, and I mean, this particular virus mutates a little slower than, for example, the flu virus, but we certainly know that it mutates. So I think the idea was, if you got COVID at the very beginning, in say March 2020 during the first wave, now we're on the Delta variant, how good is the protection that you had against the first version or the first type of the for all the variants? So to put all our chances on the right side, the decision was, let's recommend, it was also simpler because there's a lot of people who are not necessarily properly diagnosed as having had the infection, right? So the idea was, we know it's not harmful, it's potentially extremely beneficial to boost with a vaccine, even if you've had the natural infection, and it kind of simplifies life, right? So that, but you're right that from a purely scientific perspective, every individual hasn't been tested to say, okay, are you now really immune or you're not immune, etc. It's a little bit technically challenging to do that.
It's just in Israel and other countries like that, they recognize natural immunity. So the science does, I think, speak strongly to natural immunity being strong and resilient and broad-based.
Well, I think there is also recent data from Israel where I mean, they had a lot of cases with the Delta variant, right? So they thought they had good natural immunity, and they did, and then they vaccinated, but then there were some Delta cases. You know, this is all in flux, and I think, again, the important point is that having several exposures, so whether it's natural immunity followed by a vaccine or vaccine followed by a booster, is better than just one exposure in terms of sustained and all-encompassing immune response.
If I could just add a bit in there, because I do research on antibody responses, and I worked a bit on the SARS-CoV-2 antibody response, and I think you're like spot on everything, but I would just like to reiterate the fact that the virus that you're infected with will generate a very specific antibody response, and that response is not always protective against emerging variants. And that's what a lot of the studies are coming out now, that whatever you were infected with, like a year ago, if you come across the virus now, you have a much weaker response to fight off the virus, which makes sense because the virus is smart, it's going to keep mutating. So that's the essence of vaccines, right? You're injecting, you're training your immune system to cover a broad range of spike variants. So if you get infected with different variants, with the Delta, or the other VOCs that are out there, at least you know that you have some antibodies that are going to be generated to protect you from that. And I know there was a question asked about why you need your second dose. So I guess, and there are studies now, because now that vaccines are rolling out, there are a lot of studies on the antibody response following vaccine, and it's showing that once you get the second dose, your immune system is, it's much more hyperactive. You're producing a much higher level of antibodies, and that's going to give you a broad reactivity against viral variants. So if the virus keeps mutating, and it is going to mutate, at least you're protected against that. If right now, if you don't get the vaccine, I think like Patrick said, you're going to, you don't have any level of protection, and you're going to come into contact with a virus that has mutated significantly from its original form. And so that virus is now super infective, and it's going to sort of, be really bad, essentially. So I guess I just wanted to reiterate the fact of, the importance of vaccines and having a broad immunoreactivity. And I think just like a minor comment, I think these discussions are really good, especially since, people, I think like Dr. Kreisner sort of alluded to, it's really like the opinions of people for and against vaccines very different. But I think if we understand the other side and why they think the way they do, and the questions that they have, we can properly address it. And I guess at the end of this, we want COVID to be over, right? This is like, we're all part of the same team. I think it's just a matter of understanding one another, and just understanding, I guess, a bit of why we're getting the vaccine that's separate from like the government agendas and everything. But anyways, I just wanted to add my 2 cents in there.
Can people with sickle cell anemia get the vaccine?
Yes, absolutely. They should actually. It's a risk factor for severe disease. It's one of the top risk factors for very bad disease.
Because I have a cousin-in-law, and she has sickle cell, and she said she can't take she can't get vaccinated for whatever reason. I don't really know. I never asked her.
Yeah, no, there's no contraindication for her to get it. I don't know about the particular this particular case. There might be something else, but yeah, no. On the contrary, those kinds of conditions put you in sort of a priority list to be as protected as possible.
Does it also matter with the trait if you just have the trait?
Yeah, the trait doesn't might not predispose you as badly to get severe disease, but in terms of, the vaccine is recommended for basically everybody, right?
Mhm.
Particularly for the high risk groups. So sickle cell disease is a high risk group. Sickle cell trait is less high risk. And I don't know exactly what the percentages are, but it wouldn't be a contraindication.
Okay, thank you.
Perfect. Thank you so much to all the panelists within the 3rd segment. So thank you, Diane, Michael, Dr. Dulce, and Dr. Semrick. We really appreciate your insights and your expertise that you shared on this important topic. And we've finally come to the conclusion of our event this evening. Before closing off, I would like to say a special thank you to all of our speakers this evening. So from all 3 segments, and I'd like to say a special thank you as well to all of our different partners throughout this event. So the McGill Faculty of Science, the CIUS, Centre intégré universitaire de santé et des services sociaux du centre sud de l'île de Montréal, Youth in Motion, BCRC, and l'Association médicale des personnes de la race noire du Québec, as well as the Jamaica Association of Montreal for this event. So thank you to everyone who attended. And before closing off, I'd like to pass the floor on to Sharon, who will make our final comments.
Thank you so much. And you said you said a lot, and there was a lot said tonight. And I want to also thank everyone for being here. The conversation was rich. It brought together everybody, and I think that's important. That's what we want to do. And we have 2 other segments in this series of town halls in order to do that. From talking about the schools to talking with individuals about how and what COVID is all about and how they feel about it, to what the science is so really important. And that's what we are engaging in doing, and opening the conversation and not pointing fingers at anyone, but really, as Dr. Simrit said, we are, and everyone said, we're in a public health crisis right now. And so we really need to talk to it and walk through it. Dr. Costner, we said that it takes 6 stages to get to, some kind of change. But for those who maybe, if I want to bring church in here like Michael did, if you want to give at the offering table, we do have a vaccination clinic coming up on Saturday, and that is going to be held at 6767 Côte des Neiges from 10 to 4. And I want to say it's not going to be like the classic vaccination clinical type of vaccination clinic. It is going to be kind of a reggae DJ type of vaccination clinic, with food and all that's engaged, and just, not gathering, but we're going to be coming together to, incentivize everyone who wants to and are ready to take that vaccine. Definitely to, whether it's their first or their second, or it's for children, definitely. I also want to point out that irrespective of immigration status, so all we're looking for really is an identification, because we want to make sure that everyone is covered. Those who are ready to take the vaccine can take the vaccine in a safe and inviting, not that the other places are not inviting, but another type of inviting space where people feel comfortable to take the vaccine. So thank you so much to everyone, to our speakers, Alex Adrien, Dr. Costner, Michael Farkas, to Dr. Dolce, to Dr. Semret, to Dr. Saré, to everyone who have been a part of this. A special thank you to Omar Ramos and to Sophia Sidlikowski, our youth representative, and also to Fiona Tia, who is here and helped us with the marketing and getting the poster out. We want to thank everybody, and to everyone who's here tonight to hear the conversation and to kind of digest what we said, and to kind of share that information with everyone. To Merlin Métellus also for doing the interpretation. Thank you for solving our technical issues. I know a little bit more about Zoom tonight. So thank you so much, everyone. It's a pleasure having you. And we will be hosting another session in mid-October, talking about similar things, and getting in some other speakers as well to be a part of this. Thank you, Dr. Desiree, as well, for your continued support. I really, really appreciate it. So I want to say, have a great evening, everyone. Thanks for coming out.
Thank you.
Bye-bye.
Thank you, Sharon. Thanks, everyone.